Okay, now they're coming in. Welcome, everybody. If you'd like to type in the chat box where you're located, that would be very helpful. Shelbyville, I assume Shelbyville, Kentucky. Hey, Lori. Oh, we got New Hampshire. Haven't had a lot from New Hampshire. Hey, Gary. Boone County. We have 1 minute to the top of the hour, and then we'll get started. Oh, I have 3 o'clock, so we're going to get started. Welcome, everybody. If you'd like, you can type in the chat box where you're located. That's helpful for us to know what parts of the world are being represented. We've had people from Eastern Europe and Africa and all over the place. And my cat is driving me nuts. My name's Dr. Jackie Jacob. I am the poultry specialist here in Kentucky. Sorry. And as part of my job, I organize and host the monthly meetings, monthly webinars that we have for the small and backyard flocks community of practice on e-extension. E-extension is the electronic version of the National Extension Cooperative Service, something like that, of which each state has a program. And so today's talk is going to be on internal parasites and fecal flotations to see, if you have any internal parasites. People always ask, how often should I treat my birds for worms? Well, if you don't have them, you don't have to treat them. So either your vet can do them, or you can, if you get mastered at it, I guess you could try. And we have an expert who's going to be talking today. Dr. David Frame is what do you call it, extension veterinarian at Utah State University, and he will be giving your presentation today. And while he gets his slides up, you can start loading or sharing. I just want to say that if you have a question at any time, just type it either in the chat box or the Q&A box, and I will, if it is related to what he's talking about in terms of a clarification of something, I will pop up and ask the question. Otherwise, I won't be on video or speaking. If it's not related to a clarification, then we'll hold the questions to the end. But if you're like me, I can't remember my question if I don't ask it right away. So feel free to type it in the chat box or in the Q&A at any time. So I'm going to mute myself, turn off my video, and it's all yours, David.
Thanks, Jackie. And good afternoon or morning or evening, wherever you're from. And my name is David Frame. I'm a veterinarian, and I'm an extension poultry specialist for Utah State University. And so what I would like to share with you today is some aspects of internal parasites of chickens. And we're going to try to limit this pretty much to chickens. There may be a couple of comments about turkeys or something else in there, but basically chickens. And since I don't know what level you folks are at, what I'd really like to do is go through some of the common internal parasites that you'll likely encounter. Now, these, of course, would be in North America, but we need to kind of go through this in order to understand what we're dealing with, and then we'll go into the actual protocol and how you get your fecal flotations. And I'm going to include gut scrapings into this too, because we've in the past done some webinars on necropsy, and sometimes that's where you find your answers, not necessarily just on droppings or fecal flotations. So we'll talk a little bit about that. And then we'll go into some of the actual photos of things that you might see. What we're talking about are endoparasites, and these are parasites that get inside the bird. And what this is this is just a photo histomicrograph of a gut lining, and these are actually the villi in the gut lining. And within these tissues, you can see a lot of these round things, and they're actually coccidial organisms. And this is an example of an endoparasite that afflicts the gut area. And we'll basically be talking about GI tract infections in this particular presentation. And we're going to start with coccidia. And in chickens, they only get Eimeria species coccidia, and there are 9 separate species that infect areas of the intestinal tract. In other birds, they have other types of coccidia. For instance, turkeys have a bunch of different species of Eimeria too, but they're not, they don't cross over into other species. So these species will infect certain areas of the intestinal tract, depending on what species it is. And oftentimes the location and characteristic lesions will help in a diagnosis. And as far as we're concerned, that's pretty academic, because all coccidial species are treated the same. And if you've got a coccidiosis, it really doesn't matter if it's, what part of the intestine it's in. You're going to have a situation where you're going to be treating and trying to get rid of it the same way. As I mentioned, they're host specific and they're found all over the place. And so any place that chickens are grown, you're more than likely at some point in time going to have, you're going to see some oocysts. Now, rather they're causing clinical disease is another issue, but they're around and they last a long time in the environment. And once they're into a bird, the life cycle is about a week. So you have about 7 to 10 days, depending on the species. And they go through a bunch of different forms, and they're not really important other than the fact that the oocyst is kind of the egg. That's the one that gets into the bird. And once it becomes to the point where it can sporulate, then it starts growing and forms all these things. So one oocyst can magnify itself into many, many, many other oocysts at the end of this.
We lost your sound.
Okay, still no sound?
At least I did.
Can you hear me now?
They can hear you, so it must be me. I'll worry on mine. You keep doing yours.
Okay, very good. So one oocyst can form a lot of different oocysts, and then they shed the oocysts out in the feces, and then they stay in the litter. And so it's a cycle, this kind of a vicious cycle here on the coccidia. So the amount of disease that a particular coccidial species will cause depends a lot on the disease, but it's also dose dependent. And if a chicken ingests a lot of cocci, then it's more likely to have a real problem. And they all do a certain amount of damage to the gut mucosa. Now, the mucosa is the inner lining of the gut, and it often becomes secondarily infected with Clostridium organisms, and that's what really causes a lot of your mortality and a lot of your sick birds too. You can see that this particular gut does not look good. Now, this is all starting to slough off. It's been secondarily infected with a Clostridium, and these birds are not going to feel very good. Your clinical signs are, if you just have a light challenge, you might notice some slow growth and decreased feed conversion. Overall, if you just have a few chickens, you may not even notice that. But if they happen to get a real good dose of sporulated oocysts out of the litter, then it'll cause some problems. And it's called the sick chicken ruffled feather syndrome. And they're hunched over and feathers are ruffled, and they look really sick. They look like they could die. And in fact, they can die if they're not treated at that point. The big whopping dose of oocysts can occur basically in two ways. If there's a lot of shedding into the litter and the litter is pretty dry, then those oocysts will just stay there and they won't sporulate. They have to sporulate in order to become infective. But say you have a water problem and one of your waters tip over something into the litter, and as chickens are, they're very curious and they'll go over and start picking around in that moist litter. It takes two things to sporulate the oocysts. It takes moisture and it takes heat. And once they're sporulated, then they can get inside the intestines, as I showed you a minute ago, and then start this cycle up. And once those chickens get a heavy dose of these sporulated oocysts under the drinker, they can be sick in just a few hours to a day and be very sick. And so management is important in the control of coccidiosis too. And we're not going to go into a lot of management, a lot of treatment today. I'm just giving you some background that maybe will help you figure out why you're having the problems you're having. And so the diagnosis of cocci is made by gross lesions, oftentimes in chickens. There's problems in the gut. It's not so much in turkeys. They don't seem to show as much, and they can still have enough coccidial organisms in there to decrease feed conversion and have a problem. But gut scrapings are the way to go in order to make a diagnosis of dead birds, and also some fecal flotations, and we'll show that here in a minute. Just want to show you some pictures of coccidiosis. Here is the outer side of the gut, and that's called the serosa. And you can see these reddened areas. That's actually the coccidial organisms that are inside that have eaten right down through close to the outside of the gut. And if that gut were opened up, you can appreciate that's moist. There's a lot of inflammatory problems in there. The chicken is just not going to get the nutrients that he needs out of the feed that he eats. Here's another one where you can see those little pinpoint hemorrhages. That's all areas where cocci are growing within the gut mucosa, causing a lot of problems, and they can be overlaid with other problems. This is a Mariottenella situation where this one causes some bloody intestinal contents, and so sometimes coccidiosis is diagnosed with bloody feces, but not all the time. But this is one species that can cause some bloody feces. Now we get to the point where the coccidial challenge has been in there long enough that we're starting to find the overlay with the necrotic enteritis, and if you can appreciate that how thin that is right there, there's actually no internal lining of the gut right there, and it's all sloughing off. This is all necrotic tissue. So that bird's not going to get very much nutrients out of his gut for sure. In fact, that part of the gut is pretty much shot at this point. And if you were to look under the microscope with stained tissues, you can see that these organisms grow within those fingers or villi of the gut. They're also down inside the crypts and so forth. And they just multiply themselves until a point that they destroy the gut. And those oocysts shed out into the feces, and that's where we'll find them later on when we look for them. The other common things that you're probably you need to be aware of and watch for, and that's the nematodes. And nematodes are just a family of worms, mainly roundworm type things that get into the intestines. And the main one here is Ascaridia galli. That particular type of ascarid will be able to infect other birds other than just chickens. And there are some ascarids that are more host specific. For instance, there's one that we'll look at for turkeys that is more host specific, but it's basically this one that you're looking for. And all the eggs look the same anyway in the feces. So again, it doesn't really matter what it is. If you see ascarid eggs in there, you know you've got ascarids of some sort in there. The transmission is simple and direct. What that means is that it's similar to the coccidial organisms where the eggs are shed in the feces, the bird picks them up and they get ingested, and then the cycle continues like that. So they don't need like intermediate hosts in order to cause a problem, such as going through a snail or something like that. It's a direct transmission from one bird, or from one bird can pick up a whole bunch of them without having to go through any other type of organism. There's also other types of nematodes. The capillaria worms are often called threadworms because they look, as I'll show you a picture, they really do look like threads, but the main one is found in the intestines. There are capillaria that can cause problems in the crop too. And so you have to kind of be aware of that. Both of those type of capillaria will have the same types of eggs in the fecal flotation though. And so you really can't distinguish, and you don't need to. Again, if you find those eggs, you know that you got a capillaria problem. Now the cecal worm, Heterachus gallinarum, is a whole different cat. This is really important in the transmission of blackhead disease because these worms and the eggs of these worms can carry the histomonads, which are the organisms that cause blackhead. And these worms are sometimes visible. Usually, if you look really carefully in the ceca, you can see them on necropsy. And I'll show you a conundrum with these particular eggs that you might want to be aware of. That's the reason why you want to look at do some necropsies too, if you've got some birds that you're able to do that with, because these eggs will look a lot like the ascarid eggs. The cecal worm has a host range of many types of bird species, but again, it's simple and direct, but it can also, this transmission is simple and direct. And so they'll pick up the organism out of the litter and the egg, and then it gets inside of them. They can carry this histomonad, as I mentioned, and this is really the problem with Heterachus worms. It's not so much the worms themselves that cause the problem, but it's the things that they carry in with them. And blackhead is a bad one. So let's just take a look at some gross pictures of things. This is an ascarid in a chicken. That's a pretty heavy contamination or infestation of ascarids. This one is even worse. Now, these roundworms, they just sit in the intestinal tube and they'll absorb nutrients. And so the chicken has these nutrients coming down the intestines. And so instead of going to either its eggs or to the meat, it's going to feed these worms. And oftentimes, if you're not diligent in keeping track of these things, you can have infestation of roundworms so bad in the intestines that it causes blockage. And one time I used to raise exhibition birds, and I had this cockerel that was not doing well. One thing you can, with a heavy roundworm infection, infestation is that they start losing weight, and they just don't seem to be able to get anything from their food. And this bird eventually died, and I opened up its gut, and the roundworms were so thick in the intestines that they just sprang out like spaghetti. And of course, nothing could get down through there. And I really felt bad because I hadn't been monitoring or watching for this type of a situation. And if I had done some fecal flotations, I would have known. So there are some useful uses of that. As I mentioned, the threadworms look like threads. They're very small, and as opposed to the ascarids, which are in the lumen and you can see them, they're big enough that you can see them. These threadworms will burrow down inside the mucosa of the gut, and you may never see them. And probably if you're just looking at the gut itself, you're not going to be able to. And so what you need to do is to take a deep scraping, just take a scalpel and scrape down in areas that look like they're inflamed or have some problems, and then put that on a microscope slide with some water and get it diluted out, put a cover slip on there so that these capillary worms are more visible. And if you look really carefully, you'll be able to see them. Also, even with a deep scraping, if you just look at it under the microscope, you'll see the worms for sure. But of course, it's the eggs that we're looking for in the flotation. But these are what the worms look like. They can cause a lot of thickening in the crop, a lot of thickening and problems in the intestines too. So you want to be aware of those. I'm just throwing this in here to let you know that tapeworms generally are not a clinical problem. This is a tapeworm infestation. However, once in a while, you'll get enough of them that you may need to treat. And what you'll see is not necessarily in a fecal flotation, but you'll see these proglottids, these little rice-looking things. They're segments, and they'll be excreted out, and you'll see those in close to where the droppings are. And if you see that, then they've got some tapeworms. But like I say, they're normally not a big problem. However, this is a case in a turkey. Some turkeys that were let out, and I think that they got these tapeworms by eating grasshoppers as the intermediate host. And we're not going to talk any more about that because you can see the proglottids usually coming out in the feces with these things. So let's look at a little bit about the supplies that you're going to need for flotation. You can't do anything without a microscope, and you don't need a $1 million microscope. Maybe your local high school may be having a fire sale on them. They're getting new ones or whatever. You can pick them up for pretty cheap. So just even a student scope is fine. You just need make sure that the objectives on there are a 4, a 10, and a 40 power with your ocular objectives is a 10, so that you can get 40, 100, and 400 magnification on them. So you don't need any, and that's pretty standard on scopes. And so you don't need anything really fancy. The other things you'll need are a supply of microscope slides, and they're the actual slides that you would put on the scope, and the cover slips go on top of the microscope slides. And you'll need a supply of those, just some basic dissection type stuff. A sharp knife, a pocket knife will do some scrapings if you need to, and some tissue scissors. And an eyedropper comes in really handy to be able to finish off the tubes that we'll talk about on the flotation of these things, so you have some control over it. So an eyedropper or a squeeze bottle is necessary. Then you'll need a solution to float your eggs on. And zinc sulfate is really my favorite. And the reason it is because it's not sticky. It's accessible. I've got some websites on a slide up here that I'll show you where to get it. It's not that expensive, especially for the amount of times that you'll be doing it. And it's just a lot easier to work with. If you can't get zinc sulfate, or if you don't want to, you can actually make a homemade solution of sugar water. And I'll give you the recipe on that too, but it gets kind of sticky. And then you'll need something to float them in, either a 15 millimeter test tube or some OVA assays that I'll show you what they are. So we have our microscope, that's important. And then you've got your slide. your microscope slides, and then some cover slips. And I like the rectangular ones because they fit almost on the slide itself. And so it has a tendency to spread things out a little bit better. And you can either use a tube or one of these little Ovace kits. They call them Ovace, and you can buy them in bulk. And once you've bought them, you can just reuse them and reuse them. And so you don't have to keep buying them. And what they are is they have a kind of a grinder in there. And so you can put the fecal material down inside, then you put the grinder in and you twist it. And it kind of keeps all the real heavy material and large material away, so that when it floats to the surface, hopefully you don't have too much of that debris. And then the eggs or the coccidial organisms will be up in this area right here. And this is what I'm talking about, using an eyedropper or something like that, because you want to get a kind of a concave surface on the top of that, whether it's a tube or one of these Ovace tubes. And then that way you can put a cover slip. You just drop a cover slip. And in this case, like I said, it's a rectangular one that I like to use on there, and just make sure that surface is in contact with the cover slip. And then you just let it sit. Let it sit for 30 minutes, 45 minutes, whatever, not too long, but at least a minimum of 30 minutes. And at that point, you pull that cover slip off straight up so that there's still a drop on the underside of it. So you want that drop to remain there on the underside. So you don't slide it off sideways. You want to pull it straight up. And then you would apply that to your cover slip, to your microscope slide, and then it just kind of spreads out and adheres the cover slip to the microscope slide. Then you can look at it directly under the microscope and see what you're looking for. So here's some possible suppliers, and this is not an exhaustive list at all, but particularly your zinc sulfate. I found some at Granger, interestingly, for a pretty good price. And then these Ovace kits, there's probably a number of places you can get them, but this is one that I found. And slides and cover slips, a number of different scientific places will give those. And then there's a whole bunch of places to buy microscopes. And here's just a couple that I saw up there, but I would definitely check with your local school systems and see if they're getting new ones, or if they ever have surplus sales, that type of thing on them. But you've got to have a good microscope in order to do this. Then other things you can just find at your local drug and grocery stores, like eyedroppers, and if you're using the sugar, then that's fine too. So if you are using the sugar solution, this is your recipe. For every 100 milliliters of water that you use, you want to put in 128 grams of table sugar. And most kitchen scales and measuring cups will do things in grams and milliliters now, and I can't tell you how much to add per cup or whatever, because I don't work in cups and ounces. I work in grams and mils. And so this will give you at least a proportion is what you need to do. Now you're going to have to mix and heat this, and it's almost like pancake syrup. And so it takes a while to get it dissolved. But once it's in there and heated, store it in some sort of a closed container to keep it as fresh as possible. And then that works pretty well, but you do have a sticky mess by the time you're done. The other thing is that another good surveillance method of looking to see if you've got any kind of a problem in your flock is to do litter samples. And I applied this principle a lot when I was working with the commercial turkeys, where you're looking to see if any of these organisms are starting to build up. You can do this on a monthly basis or however you want to, but you just grab small handfuls and put them in a bag, mix them up really well, and make sure you get samples from around the feeders and waters, because that's where the birds are mainly going to be staying. Maybe even under the roofs would be a good place. Then you just mix those things up, and you just take a little bit out of that bag. And if there's a lot of shavings and things like that in there, you want to get all those big pieces out. And then you want to weigh out about a half a teaspoon of that sample and mix it in a test tube with about 20 mils or so of sugar. It's not really critical, but just enough to mix it all out, and then strain that through just a simple kitchen strainer. You can get these mini strainers down at the supermarkets for next to nothing, and strain that through. And then you put that strain liquid and you fill either your 15 milliliter tube with it or your Ovasse container with it. And that now you've got most of all the junk taken out. And so then you just grind it in the Ovasse and fill it up and get your concave drop with the eyedropper, put the cover slip on and do exactly what we were talking about. Let it sit for 30 minutes. And after 30 minutes, you just lift that cover slip and look to see what you see. Let's get into some of the organisms. And I've been able to acquire these pictures from a number of different sources. And the person who has given those to me, or the institution, is on the bottom. The problem with finding these is that they're so common in poultry pathology work that we do in the diagnostic lab, that we see these things so often. A lot of us have not taken really good photographs of them, and so that's one of the things that you have to remember, is that even the common things in life, take pictures of, because you never know when you're going to need them. And one thing I don't have is pictures of artifacts like air bubbles and things either, but I'll talk about that after we look at the organisms themselves. So these are coccidial organisms, and you'll notice that they're a little different shape. Okay, these things with the walls on, they kind of look like a fried egg. They have the internal part right there, and if they sit for a while and sporulate, those things will start to develop. In fact, there's a sporulated one right there. And this is a different species, because look at it. These are rounded. They're not as ovoid shape as these. And so you can appreciate they're different species. But like I mentioned, there's really not a lot of practical difference between them, because if you've got a whole bunch of these, you got a problem, possibly. If you've got a whole bunch of these, you've got a problem. So, and the treatment is the same on those. So the ascarids and the capillaria can definitely be distinguished by the shape of the organism. But if you have a roundworm problem, you should be able to find them in the gut, and so that's one good thing about those, is they're very visible. Again, capillaria can be diagnosed with a deep scraping, so you don't necessarily need to look for the eggs. But a gut scraping and fecal flotation together will give you some idea of what's going on there. Here we have an ascarid egg. This is Ascaridia dissimilis of turkeys, but the characteristics of this are a very thick wall on them, and you can see a lot of different cellular material inside there. And this is a 400 power view of it. And so this would be your 40 power objective on your scope. And so this is a fairly close-up view. I don't have exact sizes of them, but these things are pretty big. You can see them even on 100 power, you'll notice them. And so then you just have to go down and look at them, and you can see them there. Here are some Ascaridia galli. Again, they have the same characteristics of the thick wall, a lot of material inside of them, developing cells, and they're pretty distinctive if you see them. Now, here's Heterachus. It looks like ascarid egg, doesn't it? Well, that is a diagnostic problem sometimes, because unless you see them side by side, you can't tell the difference between these and your roundworms. And so just seeing these in a fecal flotation is probably not enough. You need to do some necropsies and look for those Heterachus organisms themselves. Now, if you see a lot of these type of things in your flotation, and you've done due diligence on a necropsy and there's absolutely no roundworms in the gut, then chances are you may have a cecal worm problem. And these are coming out of your cecal worm heterachus, rather than the ascarids. Capillaria organisms, eggs are really quite interesting. They are bipolar plugs. They're operculated, and they're very, they have a distinct color to them, kind of a golden color here. There's one parasite that we haven't talked about because I don't have any fecal flotations on it, but it's the gapeworm. And in some areas of the country, the gapeworm is a big problem, particularly in game birds and backyard range chickens. And what they are is they're these red, they look like a thickened piece of thread, and they're in a Y shape. The males and females attach to each other and they attach to the trachea. So it's a respiratory disease. And so if you've got a lot of coughing in your birds and you do a fecal flotation and you find something that looks similar to this, it could very well be a gapeworm situation. We do not have gapeworms in this part of the country, thank goodness. But I know back in Pennsylvania and other places, that could be a real problem. The gapeworm egg, though, will be very, very golden. It's a distinct color of golden. This is just kind of a dull golden here on these capillaria worms. But if you see these, you've got capillaria, and so you need to think about what to do about that. So if you look at all these together at 400 power, you can kind of appreciate some of the differences. The heterachus is a little more oval than that, but if that's all you see in a fecal flotation, I would be hard pressed to say, hey, we got a heterachus problem, because that could be an ascarid egg too. So as I mentioned, you may have to do some differentiation if you see a lot of that. And your capillaria eggs are very distinctive from the others, and you can see that they're quite a bit, they're a little bit smaller. Now, I don't have a picture of a coccidial organism right next to it with these, but I'll show you about the size of what they are. And this thing never works right, but I'm going to do it anyway. Yeah, I guess it did. So this would be kind of what your coccidial organism size would be compared to these others. So it's quite a bit smaller. And you can still see them on 100 power, but you have to get down a little bit lower to really appreciate them better. But they're going to be quite a bit smaller than any kind of egg you see out there at all. So I guess what it boils down to is you have to have a preliminary idea of what parasites are likely present, and you have to learn about their life cycles too, because there may be parts of the life cycle that are important in the control, and also what you see at necropsy or on your fecal float. You have to get the right equipment. Like I said, the scope is the most important thing, and then you have to learn how to use that. And it takes a little bit of practice. It's not something that you just go out there and do. But after you've done it a few times, you get some experience, and particularly in sample collection and setup. You'll find that maybe some of your litter samples have just got too much stuff in them. You can't see. You'll get an idea of how to fix that, and then recognition of artifacts. And artifacts, when I'm talking about pollen, plant material, parts, air bubbles. I mean, air bubbles look really awesome when you see them under the scope, and you think, man, there's something. And so you have to be able to see those things. And that's one of the reasons why you want to get that concave surface over your tube before you put the cover slip on, because you want to eliminate those air bubbles so that they don't interfere with what you're looking at. And one other thing that you have to be aware of, at least in this area of the country, we have these mite eggs in the litter. and these litter mites will lay eggs that look a lot like an ascarid egg. In most instances, they're a little bit bigger, but you have to kind of don't get misled by looking at litter mites. And so if you see that you've got litter mites under these flotations and scraping, well, we wouldn't see them in scrapings, but in litter flotations, you might want to go back and then just pick up straight feces and droppings from the bird, so you get as little litter in there as possible, and then go back and float again and make sure that these are ascarid eggs and not litter mites. So that all takes some experience in order to do that. But then the interpretation of the findings is, so you find a few cocci-organisms in a flotation. Is that critical? Is that causing a problem? I mean, are these chickens sick because of it, or what does that really mean? And if so, how do I treat them? What do I treat them with? How often do I treat them? And how do I prevent future problems? And this is where your local veterinarian should be able to help you out. And particularly if you get a good rapport with them, he or she may be able to set up some time for you to look under the scope and see some of the scrapings and flotations and things, because what they find in dogs and cats are, they set them up exactly the same, and you're seeing the same things under the scope that would help you gain some confidence in what you're looking at. And so this is a tool. It's not a magic bullet to be able to tell you what to do, but if you particularly litter sampling, if you do that on a consistent basis, that'll give you some idea of what's building up and what problems you might have going forward. And as Jackie mentioned at the beginning, there's no sense in treating for roundworms, for instance, if you don't have roundworms. It may be, they may not have any kinds of parasites at all. They may have a larger load than you think they've got. And that'll give you a jump on things, so you don't end up like I did with my chicken. So actually, that's what I've got today for you. And if there's any questions, and I'll see if
we
I
do
can
have
answer them.
one question. Rodney says he makes his own float solution using magnesium sulfate, i.e. Epsom salts. I get a solution resulting in a specific gravity of 1.29 with my hydrometer. Is it okay to use this solution, or does it affect the eggs and the organisms he's looking for?
I think that's great, and especially with getting it to the right specific gravity, it doesn't really matter what you use. You could. The good thing about something like that, it gives you the opportunity to get that molar situation in there to get the specific gravity up, and that's the reason why zinc sulfate and things like that are used. But I see no problem with it. Personally, I haven't any experience using the magnesium sulfate. I use the zinc sulfate, but it's
should be the same.
It's a specific gravity that you're concerned with, because you want those organisms to be able to float up above it.
I know you said you weren't going to talk about treatments, but somebody asked, would you ever use diatomaceous earth to treat any of these organisms? The good old diatomaceous earth question.
Yeah, probably with these, it's not going to help much. Those eggs form real stiff cysts, and the diatomaceous earth is probably not going to cut into them. That's useful for insects and organisms that have an exoskeleton and things like that. So it's probably not the best thing to use. There's other things that are better.
You probably damage the intestines from the diatomaceous earth rather than doing anything else.
Yeah, occasionally I've heard of people actually giving diatomaceous earth orally, but it's like giving cut glass. I don't know how good that's going to be in the intestinal system as a whole. So,
right.
And it's really not going to do much for the organisms anyway. They're multiplying fast enough in there that that they'll be moving forward. Right.
Any other questions? David, before you leave, there is one person on here who emailed me a question this morning that you would be able to help with. It's related to the topic. We'll do it if nobody has any more questions. Any more questions? Then thank you very much. And next July, there is no webinar. The next one is in August, talking about sanitation in a poultry house. So thank you very much. You're free to go, and we'll deal with Anne's question. Anne, I'm going to allow you to talk. Oops.
Can you hear me?
Yes.
Yes, we can hear you.
Awesome. So I have about 30 11-week-old hens, well, a couple of roosters in there. And early on, probably, and I've never had this problem before, like 6, 7 weeks, I saw a little bit of bloody poo, and I was like, okay, so I did a round of Corid with them and thought that it got better. And then yesterday, all of a sudden, my husband went, and I have dropping boards in there so I can kind of see exactly what's going on. And there was, several spots of just almost like pure blood. And I was like, good heavens, but nobody's acting sick. And again, this morning, same thing. So I've started Corid again, but I've heard a lot about toltrazuril, and it seems like that's used in other countries, but maybe not so much here. And I see other people talking about it being used for chickens. And they said that that's like, if you have a severe infection, that is better than a coxistat. And that would work better. I just didn't know if it was safe to use on my chickens as far as eating their eggs at a later stage, that kind of thing.
Well, that's what I was going to ask you, if these chickens are actually laying eggs that you're consuming. And the Clasaril, I'm not sure what all the withdrawal times are, or if it's even legal in the United States.
It's not approved in the United States, according to the article somebody sent here.
Yeah.
Yeah, I mean, they're only 11 weeks old, so they won't be laying for a while.
What I would do, Anne, is go ahead with the Corid treatment. But what I think has happened, if they may very well have some coccidiosis. And again, the only way you're going to be able to check is do a fecal flotation on them,
Right. Well, I took some to my vet after the first round of Corid, and he didn't see any. So I was like, okay, then I guess we're doing good. And then now this happened. So.
Okay, so what happens with this is that the coccidia will build up and in the litter and in the environment. And then if you give them a therapeutic dose of Corid, you'll wipe all the cocci out of them. Okay. And so they look really good, but then they go back as soon as you quit the treatment, then they'll go back in the litter and pick up a whopping dose again, and you can have just as sick or sicker birds on the second go around. So what you want to do is treat with the therapeutic dose of Corid for about 2 weeks, and then drop it down to half and go another week in order to get what's called leakage in there. So you want a few organisms inside the gut to give it some immunity. If you wipe them completely out, they have no immunity, and then they'll go right back to the same problem.
All right. So full dose for 2 weeks, and then cut it in half for 1 more week.
One week to kind of give them a chance to ease into it and get a few into their gut.
And at what stage? Because I'm like, if I clean the litter now, they're just gonna poop cocci all over the place again. At what stage would you try to give them the cleanest litter?
The cleanest litter is actually, you'd want that right after your therapeutic dose, because then they're not shedding as much, and then you get that litter out of there, and then they won't be exposed to so much. But anytime, even after you've done the subtherapeutic level too, anytime you can get the litter out of there, that's going to help reduce the number of organisms, and so you're just helping yourself. But my off the cuff situation with this, it sounds like you might have a recurrence of coccidia simply because you didn't wean them off of the Corid the first time.
Okay. Well, try again. I've never had such a bad cocci issue this young, so I'm like, what am I doing differently that's not working? So
Yeah,
All
the
right.
photos she sent me were bright red blood, lots of it. You'd think they were hemorrhaging.
I know. I'm like, how much blood can they lose?
Tenella will cost quite a bit of that, and so that might be what you're dealing with. But I would certainly give that a try, and it might even be wise to do a fecal flotation on them before you start treatment.
Okay.
And it might give you an idea of if you're dealing with some coccidia, but it sure sounds like it to me, just off the cuff.
Awesome. Thank you so
And,
much for your
and
time.
if any of them die, do a necropsy on them to look inside the intestine.
Gotcha. Absolutely. Thank you.
My
We have-
pleasure.
We have one more who asked to talk to you. There you go, Kendall. There you go.
Perfect. Thank you so much. So quick question about medicated feed. So my background before I got to Extension was working for a feeding grain company, and we often recommended using medicated chick starter, ampicillin, being just in a preventative dose to folks who wanted to raise chicks and move them outside quickly. And of course, being in New England, everywhere has coccidiosis in the ground because we're old farmland. So we really struggle with that out here. But one of the things that people started bringing to us was a concern that medicated feed was causing wryneck in their chickens, because there's this myth or maybe a conception that the ampicillin is causing an issue in uptake of vitamins in the intestines. Just wanted to get some perspective on that so we can talk intelligently about that when people ask us about that.
I'm not sure. I've heard of that before, but I've never seen it with Ampro causing that kind of a problem. My question is, can you even get medicated feed anymore? Because it's since the FDA ruled back in 5 years ago, that's pretty difficult to get your tetracycline and so forth in that starter feed. Have you looked to see if there even is medicated feed anymore?
You can still get medicated with amprolium.
Yeah.
Yep.
Yeah,
Yep,
because that was not included in that particular rule, and that's the reason.
Yeah.
Yeah.
This is actually my take on it, and for what it's worth, is I see no reason in putting amprolium in starter feed, because unless you have a real dirty place, and those chicks are probably not going to be exposed to it for a couple of weeks. It would really be nice to have it in like the next feed up. So it's not going to hurt anything, but it's not in there at a dosage level enough to cause any problems that I know of. And I've never seen a vitamin deficiency problem caused by the Amprol itself.
Interesting. Yeah, so I think because New England is so wet in the spring, and that's, people get chicks in
Right.
spring. That's kind of the thing. People see a lot of that cross-contamination between their existing flock, or maybe they're not using proper hygiene when coming inside, or they're handling big birds first, coming inside, handling the chicks next, and they're kind of out of step with maybe best practices for sanitation.
Yeah, and in a case like that, that can help. Any coccidial organism is eventually going to get resistant to whatever you use. And so that's the other reason why I don't like to use it on a regular basis, simply because you're giving a subtherapeutic dose to them. You're just exposing those organisms to the point where it's the survival of the fittest sometimes, And of course, you guys are dealing with a lot different situation than we are. I mean, we're 15% relative humidity out here, and so you may need a coccidistat earlier in that growing cycle than we would.
Perfect. Well, thank you. I really appreciate your perspective on that.
Yeah, if I find out anything, I'll let Jackie know. I'll look into that a little bit.
Great.
I'll look
Thank
into
you.
it too, see what it says.
Yeah,
Okay,
that would be awesome. Thanks.
great.
Thanks, Kendall. Any other questions? Okay, I'm not seeing. This was recorded, and there's a message. Thank you. This was very interesting and informative. So lots of thank yous now. The next one is in August and will be on sanitation. As I was saying, this is recorded, and the recording will be posted on our YouTube channel. You can find it through our website, poultryextension.com or veggiextension.org. And I will also put it on the Facebook page. So thank you very much. Great job, Dave, as usual.
Thank you.
Bye-bye.
See you.